Neurostar TMS therapy, a proven non-drug treatment for depression that is bringing hope to patients every day. If you are suffering from depression, you are not alone. Severe depression is a serious illness that affects approximately 350 million people worldwide.
The depression very much defined who I was. I wasn't able to work, wasn't able to hold a job very long, wasn't able to maintain relationships of a certain intensity at a certain point. I was just in a constant state of unhappiness, misery.
For me, depression was like a black hole of emotional just sorrow. It just took away my entire life. I couldn't think, I couldn't work, I couldn't enjoy anything. I couldn't enjoy my children. It was just completely overwhelming.
While medications may help manage symptoms of depression, many patients are not satisfied with the results they get from standard drug therapy. Because these drugs circulate throughout the body, they may result in unwanted side effects.
Although I had depression since I was a teenager, I wasn't officially diagnosed and given medication until I was in my 40s. And that medication worked for a while. However, it made me numb, and the side effects were intolerable. I gained weight. I just didn't feel connected to myself and to my world.
I've been on dozens of different medications. Some of them I couldn't tolerate because of the side effects. The sweating and the dry mouth and the not being able to sleep, and they didn't provide the relief that I needed.
Neurostar TMS therapy is a proven non-drug treatment for adult patients with depression who have not benefited from prior antidepressant medication. Neurostar TMS therapy uses a treatment coil to send a targeted pulsed magnetic field similar to that used with magnetic resonance imaging or MRI, to stimulate key areas of the brain that are underactive in patients with depression. Because it is not a depression drug, Neurostar TMS therapy is free from the side effects that patients often experience when they take antidepressant medications. The most common side effect with Neurostar TMS therapy is pain or discomfort at or near the treatment site. When this occurs, it is temporary and typically occurs only during the first week of treatment.
This was a different technology. This was different science. It was the first actual alternative that I'd ever been presented with. And that's what made the difference for me, that this was a real change that I could make.
For many patients treated with Neurostar TMS therapy, depression symptoms significantly improved or went away after 4 to 6 weeks of treatment. In general clinical use, 1 in 2 patients experienced significant improvement in their symptoms, and 1 in 3 patients were completely symptom-free. In 2 independent randomized controlled studies, Neurostar demonstrated clinically significant depression symptom improvement in patients treated with active TMS therapy versus sham TMS or placebo. A growing number of patients have received Neurostar TMS therapy, with more patients being treated every day.
I didn't notice the signs of improvement for a few weeks into the process. My family noticed it that first week. They said that I was sitting up straighter, that I was more engaged.
The amount of progress that I made in the 6 weeks of TMS treatment was just phenomenal. I felt better than I have in years, and I was taking 6 medications. Then when I finished TMS, I have one simple antidepressant, and I'm feeling great.
Treatment sessions for Neurostar TMS therapy are conducted right in the doctor's office. During treatment sessions, a small curved device containing the magnetic coil is positioned on the head, and delivers magnetic pulses over the 37-minute treatment period. The patient will hear a clicking sound and feel a tapping sensation on the head. Patients are awake and alert during treatment and can go back to their normal activities immediately after the treatment session.
To me personally, it was pain-free. There is a little small amount of tapping on your head when the treatment's going on, not continually. It stops and goes. I did not experience any amount of pain whatsoever. The chair was very comfortable. It was a 37-minute treatment that went very easily for me.
Well, it's surprisingly simple. My first day of TMS, I sat in a very comfortable chair, and my TMS coordinator, who was terrific, explained to me that the therapy would not be a quick fix, that I, again, needed to understand that it was going to take some time. I was very grateful for that because it made the experience so much more comfortable, knowing what I would expect from the treatment.
NeuroStar may be right for you. If you agree with 2 or more of these statements, ask your doctor about NeuroStar TMS therapy. Depression symptoms have interfered with my daily life. I am not satisfied with the results I get from antidepressant medication. I am interested in a proven non-drug therapy for depression. NeuroStar is providing hope to patients every day.
7 months ago, I was so depressed that I wasn't able to function. I couldn't work, I couldn't drive, I could barely watch television. After the 6 weeks of NeuroStar TMS therapy, I was back to work. I was feeling great. I was enjoying my kids again, and I had my life back.
I found myself answering phone calls and reaching out to friends and wanting to talk to people, which I hadn't done for ages. It was a light feeling.
That's when it came together, when I was able to see where I had been, where the treatment itself was working enough that the fog that the depression puts over your self-perception was lifted, and I felt hope.
NeuroStar TMS therapy is a safe, proven, non-drug treatment for patients with depression who have not benefited from antidepressant medication. This novel treatment approach can relieve depression symptoms without the side effects associated with antidepressant medications. Remission from depression is possible. Ask a NeuroStar physician if TMS therapy may be right for you. NeuroStar TMS therapy is indicated for the treatment of major depressive disorder in adult patients who have failed to receive satisfactory improvement from prior antidepressant medication in the current episode.